Hi, and welcome to Wow Talk. I'm Donna Capacity, a thriving cancer survivor.
And I'm her naturopathic doctor, Darlene Gustin. We're here to encourage, educate, and empower you on your journey to optimum wellness.
Hi, and welcome.
And today we have a very special and interesting guest on our podcast, Dr. Nina Petri, Naturopathic Doctor. So I have known Dr. Petri for 20 years or so as a patient, and after 20 years of being a patient, she was inspired to become a naturopathic doctor herself, a very resilient, kind doctor and lady who also ended up specializing in helping patients with concussions after her own personal journey, healing herself. So welcome, Dr. Nina Petri.
Yes, welcome. This is so exciting to have you here.
Thank you.
And to talk about concussions, you know that a lot of people have them. I'm sure people even have concussions when they don't even realize that they've had them. So why don't you talk to us a little bit about your whole practice and what you do?
And the special certificate that she has. So it's not just being a naturopathic doctor. She went and took an additional professional level training and is certified in something called complete concussion management. So please talk to us about that, Dr. Nina.
Exactly. Let's start with that.
Well, it's a program that evidence-based that provided by a team of health professionals to help the patient to recover faster and more completely. The main goal is to restore the patient in a pre-concussion optimal level of health. And I do that in conjunction with health professionals that are also certified by complete concussion management, as, like vestibular therapists, physiotherapists, chiropractors, neurooptometrists, etc. And this provides, it's like an integrated model of healthcare. And as a naturopath doctor, I'm a provider, primary health provider, and with modalities such as nutrition, acupuncture, supplements, stress management, and strategies to reduce inflammation.
Okay, could we go back a little bit and describe to our listeners what exactly is a concussion? What is that?
Well, that you want the actual mechanics of it?
Could you tell us what that is?
Sure. It's actually it's when you hit your head, it's escalation of the movement of forward and backwards, and
Of the brain.
Of the brain.
So slish slosh.
Yeah.
So the brain inside of the skeleton is surrounded by linings and fluid, like a big.
You want to say like a helmet almost, like with light, like a protection in there?
Yeah,
Okay.
sure, almost like that. And then the brain injury, it kind of gets jolted forward, bang at the front, and then it jolts back, bang at the back, and so that's what happens because the impact is a larger impact.
I mean, because you hear about them your whole life. You think maybe you might have had one or not or what have you, but I never really knew what it was mechanically.
What it does exactly, it stretches the axons of the neurons.
Okay.
And it causes inflammation.
Okay.
So that's what
So
it does.
that's it. So can you describe what is covered in your program?
Well, it's okay. So as a first practitioner, I start to see the case history, and I provide with specific concussion recovery diet to reduce the inflammation. I also determine if they need some tests and supplements after physical exam. And often I refer to chiropractor or physio and some other trained professionals. It's basically a coordinated team between myself and some other health professional partners, so to speak. So this is all to increase the quality of life of the patients as soon as possible too.
Okay, so someone would come to you. Let's say there's someone who's had an injury at a hockey game or something, right? Someone gets
Right.
hurt and they think they might have a concussion. So they would call you up, they come into your office, and right away you start asking questions about what happened. And you can determine usually by just asking about the history, about what actually happened.
Yes, the history and exactly what happened, the symptoms, and sometimes it's very obvious that it's a real emergency, and you have them to send them immediately to
Okay.
emergency.
Could you tell us what some of those symptoms would be? Or all of the symptoms, really?
Well, if they lose consciousness for a very long time, for example, if they vomit a lot, if they have convulsions, seizures, if they are completely, if they have lack of coordination.
But that would happen at the location where the injury happened, more acute.
Okay.
So that's not usually the patient that a naturopath sees.
Okay,
so
that
then
was-
obviously naturopaths work more on chronic health conditions.
Exactly.
Yes.
And the patients are ambulatory and they physically showed up to the appointment. And naturopathic doctors do a very thorough physical exam.
Yes.
So everything that a medical doctor would know how to do, plus the naturopathic modalities type of physical exams. And the best way that I explain to my patients how naturopathic medicine integrates with other professions, especially in the case of concussions, which is what we call a musculoskeletal injury. It's a mechanical thing, but we're focusing more on the chemistry. So Dr. Nina mentioned the brain recovery diet and inflammation. There could be deficiencies of things like zinc or protein that can really stall the quality and duration of healing, wound healing.
Mm-hmm.
So naturopaths are more like the chemistry and nutrition. And when Dr. Nina coordinates with the other people, professionals trained in complete concussion management, the people that she refers to tend to be more the mechanical types of medicine. So it could be physiotherapy, could be chiropractic, could be an osteopath. So they're working more on the physical body, we're working more on the chemistry and even on the emotional and stress part of it.
Yeah.
So I guess those are my questions then. Then how would you know if perhaps you do have a concussion or you had one, I guess, previously? What would be the kind of symptoms that would bring one in to see you to treat it?
Okay. You would see brain fog, dizziness, extreme fatigue, changes in sight and hearing, meaning very sensitive to lights and sound, nausea and vomiting. Some people even have loss of consciousness for a short time. It can eventually affect your emotional health. You get depression, anxiety. Those are the main thing that you see.
Okay, so that would happen over time, right? You might be feeling depressed. You don't really know why. You have a lot of fatigue,
And anxiety.
feeling dizzy,
Yeah.
those sort of things. You
Yeah.
might say, well, maybe, from that time I fell 20 years ago, could it even be something from way back? It can, right?
Yeah, yeah.
Okay.
And often in my practice, patients often don't connect the two things, and they'll come in for something like migraines. And I'll say, how long have you been having it? Oh, for about 2 years. Okay, how did it start? When did it start? And they're going, isn't that when you just told me you had your head injury? And all of a sudden it clicks and they realize going, wow, these migraines could actually be ever since I hit my head. And it doesn't even have to be head and neck symptoms. It could be anywhere else in the body. So Dr. Nina, as naturopaths, we know how many brains people have. So can you talk to the fact that we now know in anatomy that there are 3 brains, not 1?
Yes.
And what does that mean?
There is the brain, the heart, and the gut. They're all interconnected. And it's very common to see cardiovascular symptoms and digestive changes after concussion. The gut issue starts immediately after the concussion happens, and it's important to address inflammation as well. I also wanted to mention that connection between eyes, neck, and ears. If one of them, it has to be balanced between the 3. If one of them is not in balance, you would have some kind of symptoms. And this is why it takes the whole team of people that I mentioned before to help to heal and for the patient to recover.
Okay, and so do you treat patients of all ages, children to seniors?
Yes, I do. The truth is, many concussions happen in contact sports, so it happens more in younger people, but it can happen in elderly too. It can happen in any age. You can slip in your driveway, right? Cleaning your eyes, right? So the thing is, if it's not healed, the problem with contact sports, if they sometimes go too quickly back. So if the concussion is not healed, there is, first of all, increased risk of future concussions and injuries in general. And because the brain needs at least 30 days to recover. And when it's longer than 30 days, then we call it post-concussion syndrome. And this is usually the patients that I see.
Okay, so you touched on something earlier about nutrition as maybe being one of the ways to treat concussions.
Right.
Could you elaborate a little bit?
Well, as a naturopathic doctor, we tailor the nutrition and our treatment in general towards the need of the patient. We customize it. So what is common to see, the most common thing is for the patient to benefit from specific things, right? So, for example, we cut back or eliminate sugar. We can put the patient on gluten-free diet. We tell the patient to stop coffee and alcohol. Those things are stimulants, and they affect the brain directly. So those kind of things.
Those kinds of things, and it all depends on the patient and the individual and what they need and require and all that. Okay. Yeah, that's really interesting because I wouldn't have thought about nutrition having to do having anything to do with a previous head injury or something. So very interesting.
The diet has to be very clean, very, very clean diet. No junk.
And the definition of clean varies from patient to patient.
Yeah.
So there are some foods that are commonly inflammatory, like sugar and caffeine. Yeah. But also, if a patient has had food sensitivity testing, which is highly individual to a patient, or if they know their blood type food list, those are other excuses for inflammation in the body. So any version of reducing inflammation through healthy diet catered to that individual can drastically help reduce the symptoms and speed up the healing of that patient.
Okay.
Right.
And same thing with deficiencies. There's 500 supplements to choose from for wound healing and concussions, but you want to know which 3 to 5 supplements really work on me. And so that's what naturopathic doctors do, is we determine your deficiencies. Does this patient need fish oils or zinc? Are they eating enough protein? Because a lot of people are on vegan plant-based diets, and you need extra protein to heal after you've been injured. So the nutritional approach, supplement approach, anti-inflammatory approach becomes highly individualized.
Okay, that's fascinating. Now, is there anything else you would like to share with us?
Yes, there are 2 things. First of all, I wanted to say that all concussions are associated with whiplash. Every time when you have a concussion, you have a whiplash as well. So it's interesting that actually the whiplash doesn't take much. It's 4.5 Gs. And when you have a concussion, it's 70 to 120 Gs. That's the actual
impact. Like G-force? Is that what we're talking about here?
Exactly.
Okay. Sure.
Now,
wow.
So it's enough to cause a whiplash with 4.5 Gs. So every concussion will have a whiplash. And this is why I refer to chiropractors and physios. The neck has to be treated in conjunction to what I do.
Okay.
And the other thing I wanted to mention is some stats. 30% to 40% even of all acute concussion patients, if they don't heal within 30 days, then it becomes chronic, and that's what we call post-concussion syndrome. And it's usually because the patient did not see immediately a health practitioner like myself to be treated right away and to diagnosed and treated right away, and in conjunction with other professionals.
Or treated in a holistic way.
Yeah.
So you may have seen a chiropractor because you think, oh, I hit my head, I'm going to see a chiropractor, get a massage, physio. Yeah. But the nutritional status, the inflammation, the deficiencies can really stall your progress. Yeah. So I find that when I give my patients some nutritional information, their progress with the physical therapy suddenly speeds up. Their adjustments hold longer.
Sure, and that makes sense. Yeah.
The last thing I want to mention, we cannot underestimate the mental health of a patient. Sometimes the fact that someone has depression or anxiety can inhibit their recovery. So we have to look at that facet as well.
Okay. Wow. Now, on a completely other note, did I not hear something about an award or something?
Dr. Nina. So Dr. Nina's clinic has been nominated for the Top Choice Award in her town of Oakville for the 5th year in a row. So congratulations, Dr. Nina.
Yes, fantastic.
And listeners, please vote for Bronte Natural Health Clinic at voteforus.ca for the Top Choice Award for 2024. Congratulations.
Yes, fantastic.
And thank you for coming. That was really fascinating.
Yes,
great job.
Learned so much today. Yes, thank you. Thank you very much. And thank you all for listening. And if you have any questions, please email us. We will send on your questions and comments to Dr. Nina. Thanks again for joining us. And
thank you.
Bye for now.
Bye.